All right, if you know anything about SCAN, you know that we deal with senior citizens on a daily basis. And one common problem that we find with many seniors is a loss of hearing. But a lot of people don't like to acknowledge that they're having trouble hearing. I get it, I really do. But you're missing out on life and it really can make you isolated. So we want to help you. We want to encourage you to do whatever you can to restore your hearing. And it's part of just living your best life. So if you want to know more about this, please just stay tuned. Hey, good morning, everyone, and welcome to Scan FYI. My guest today is Dr. Stella Fulman. Good morning, Dr. Fulman.
Good morning. Thank you so much for having me.
A pleasure, because you know what? This is a topic that we talk about at SCAN, but I'm not sure that we've ever talked about this on FYI. I think it's really important. So you are an audiologist, and first I'm going to ask you to just introduce yourself a little bit. Tell us a little bit about Audiology Island and what is it that you do as an audiologist?
Absolutely. I'm one of the doctors of audiology at Audiology Island. I work alongside Dr. Shapiro. We've been in practice for about 14 years with three locations on Staten Island, and we recently, about 2 years ago, opened up in Holmdel, New Jersey. We saw the need for doctors of audiology here, and we have a clinic right on Route 35. And we work closely with all the doctors in the area, ear, nose, and throat doctors, regular physicians, and we're also affiliated with NYU for patients who are candidates for cochlear implants.
All right, now for someone who is not sure what an audiology doctor is, just explain when you're an audiologist. So what does that mean?
Absolutely. When people ask me, what do you do? And I say, I'm an audiologist, usually the response I get is radiologist. What do you do? Fix radios? No, an audiologist is a professional, a medical professional who works with hearing impairments, balance, tinnitus, which is ringing or any sounds in the ears. And we have doctoral degree.
All right, so what are some symptoms or signs that me or a loved one, wow, I need to see an audiologist?
Absolutely. Hearing loss usually happens gradually. There's no pain that's associated with it. That's why when I see patients in my office, usually I hear, well, I don't have a problem hearing. Sometimes I miss a few words here and there. I have difficulty understanding what people are saying, only noise, only maybe in restaurants. Or what I usually get is, well, my wife is complaining that I'm not hearing,
Yeah.
but I think I hear fine. Or the TV is blasting. So usually the first signs would be the television being brought up a little bit higher and asking what a lot.
Everything that you're saying, we hear this all the time, especially the one about the TV is blaring. Everyone in the whole house is hearing it, and the person in the room is, raising the volume. So that's definitely a sign that you need to get some help there. So, all right, if we go to an audiologist, and what are the things that you might do for me when I get there? How are you testing and assessing my hearing situation?
Absolutely. Well, one thing that I want to mention, which is very important, is that it's extremely important to have a baseline done. People tend to have their eyes checked, their teeth checked, their blood work done, but they tend to forget that ears are so important.
Right,
And
that's true. Yeah.
absolutely. So just to get a baseline on file doesn't mean that we will find a problem. You can have normal hearing, but years down the line, you never know what kind of medication could be prescribed, and that medication can affect your hearing. And if you have that baseline to refer back to, that would be great to know if your hearing is declining or not. But to answer your question, when a patient comes into the office, We will look into the ears, make sure there's no wax in the ear canals, no obstructions there. There's special tests that we do that check how the eardrum moves, and we'll definitely check how you're hearing. A screening is just pass or fail. That's where a lot of places do. We are a medical clinic, so we do a full audiological evaluation. We want to make sure that there is no fluid in the ear, or is it a problem with your auditory nerve? How good is your clarity? Your hearing might not be as bad, but your clarity might be affected, and that's why you might be struggling. So we'll be able to tell all of this.
So I'm thinking, I'm listening to what you're saying, I'm absorbing this. It's true. I go to the eye doctor, every year so he can see exactly what the trend is in my vision. But I guess it's a good thing to go have your ears checked, even though you think nothing is wrong, because you're saying that the loss occurs gradually. And
Absolutely.
this way the doctor can really see the trend if there is any difference. So that makes a lot of sense to me. You were mentioning that medication can have an effect on your hearing. What kind of medications might affect my hearing or cause loss over time?
So, ototoxic medication, chemotherapy, any cancer treatment can definitely affect hearing. Even high dosage of aspirin can affect hearing.
Is it fair to say that loss of hearing is not a natural part of aging?
It is. Everyone who's over the age of 45 should have their hearing checked, the same as eyes. We tend to start to lose our hearing
We
as
do.
we
Oh.
age. Yes, but there are other factors that can cause a hearing loss, such as it can be hereditary. It could be medication that's affecting it. It could be noise exposure. It could be a little bit of everything.
So, you know what? Let's just talk for a minute about noise exposure. Exposure. Baby boomers like me who went to a lot of concerts. And back in the day, there was no idea of earplugs or
Yeah,
anything else. And even the musicians now, wear ear protection. But back then, of course, nobody did, right? So,
absolutely.
that might catch up with us, right?
Yes, of course.
Yeah.
So if you're home working with power tools, even in the backyard, make sure you use ear protection. We always urge everyone to use ear protection.
Because back in the day we didn't have such a thing, but I think now even if you're out cutting the lawn you should be wearing ear protection, right?
Absolutely. And if even if you're going to concerts, there are custom earplugs that we can make specifically for your ears. A lot of people complain that the ones that they get in the pharmacy, they don't stay in the ear, they hurt their ears. So there are custom earplugs that could be made for musicians or for somebody who is working with heavy equipment and exposed to loud noises.
Oh, see, very interesting. And by the way, all of Dr. Fullman's information, all contact info, all in the show notes. You don't have to worry about a thing. So, of course, a lot of people, as they get older, they're very self-conscious. Let's even use the word vain. Oh no, 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 I hear fine. I don't need a hearing aid. Meanwhile, they can't hear anything you're saying to them. It's like to me, it's like someone who can't read the menu but won't put on their glasses. It's
You're
it's the
correct.
same thing. So what do you want to say to people who are super self-conscious? I know there's a lot of innovations out there. What do you want to tell people?
So, you're bringing up a very important topic. I see patients in my clinic every day, and people don't know much about hearing aids. And when hearing aids are recommended, usually I get a response, "Oh, no, 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 I don't need them.
Panic,
I'm
panic.
fine."
No, no, no.
Exactly, exactly. And then when I show what the hearing aids look like, people are more accepting of the fact that yes, it's not visible pretty much at all. There are hearing aids that are completely invisible. There are hearing aids that you can wear 24/7. So for about 3 months, They are completely invisible. We put it right next to the eardrum. And then every 3 months, we just change it for you. So if vanity is an issue, absolutely there's something that's out there. There are tiny hearing aids that go inside of the ear canal that also you can take out at night. They're not visible at all. Nobody will ever know you're wearing hearing aids. And the technology has gone a long way. You don't get those big horns in your ears anymore,
Right.
boxes around your neck. They have Bluetooth technology now, so you can answer your phone calls right through the hearing aids. You could listen to music through hearing aids. So even newest technology has artificial intelligence. There's so much that's available today.
All the more reason you should see an audiologist because, well, that brings me to my next thing is okay, yes, you can buy these things over the counter.
Mhm.
Yes, and that's maybe a great thing, but how could I possibly know what to buy? How could I know this?
So we recommend to see an audiologist first. A lot of people try to self-diagnose, Dr. Google,
Dr. Google,
going
very popular
online. Yes,
name. No appointment needed.
absolutely. It could be just something as simple as wax, and you're rushing to the pharmacy to try to get a so-called hearing aid. You have to understand that there is a difference between prescription grade hearing aids and over-the-counter hearing aids. Prescription grade hearing aids are made specifically for a patient for their hearing loss. I'll give you an example. When you go to an eye doctor and glasses are prescribed, it's the same as saying, oh, no, no, it's fine. I could just go to the pharmacy, get a magnifying glass, and when I need to read something, I'll use a magnifying glass. Well,
Yep.
over-the-counter hearing aids are pretty much magnifying glasses for the ears. They help bring the loudness up, but there's no clarity. And you don't know if it's giving you the right hearing. Is your hearing loss more in the low pitch sounds, in the high pitch sounds? Also, there are some conditions that could be causing hearing loss, and you need to see an audiologist to rule out anything medically going on before trying to get the treatment.
Well, that, hearing you say it, of course, it all makes sense. Great analogy on the glasses in the drugstore because, yeah, and I don't know what's wrong with us out there that we don't take care of our ears. And when you can't hear, I think hearing loss is very isolating, especially for seniors. There's the reluctance to talk on the phone, right? And to engage in conversation, even with your family, because you just don't know what people are saying. But turns out there's many things we can do about this. So again,
And there is a
all
lot of
Dr. Fulman's
research.
info is in the show notes. Sorry.
Thank you. Sorry. There's a lot of research that shows the correlation between hearing loss and many comorbidities. It's not just your ears that are affected, it affects your overall health. Hearing loss is associated with anxiety, depression, cognitive decline. It's been linked to Alzheimer's. And the longer you wait to address your hearing loss, if you've been diagnosed with it, the higher the chances are that your clarity, the ability to understand speech might go down. There is a lot of research that's available today that we see that hearing loss affects your whole body.
And this is something that we talk about at Scan, but has a different tone when it's coming from you, an actual doctor of audiology. It's so important to have your hearing checked. I just can't say it enough. And come on, guys, what are you waiting for? Just go out and do it. But you know what? One final thing that I want to mention is an tinnitus or potato. How do you say it?
Tinnitus, tinnitus, you could say it either
Drives me
way. Yes,
crazy.
yes.
So I know that this is a very, very common situation for many people. Can you just talk about it?
Absolutely. So I call it tinnitus. That's how I learned it in school, but saying tinnitus is not wrong. What is tinnitus? It's any sounds that we hear in the ears. It could be buzzing, it could be even music in the ears, it could be hissing sounds. And unfortunately, when people go to their doctor and they say, well, you know what, I have ringing in my ears, many doctors say, well, sorry, there's nothing that could be done. And that's not true. Yes, there's no miracle pill out there that you can take that will fix this problem. But the first step is getting the right diagnosis. What exactly is causing that hissing, ringing sound in the ears? What is causing tinnitus? It starts with a hearing evaluation. Sometimes it could be just wax in the ears. When we take the wax out, the tinnitus stops. Or it could be something more significant. There could be a medical problem. You want to rule it out. So again, it starts with a hearing evaluation.
I had no idea how common this was. And is this something that's age related, younger, older, or is it just because I'm working with a lot of seniors, I hear about it so frequently.
Most people that have hearing loss have tinnitus.
Oh,
And yep, and we see more and more young adults, teenagers with tinnitus, and that's because their ears are exposed to a lot of noise.
yeah.
When you go to a concert, you come out and your ears are ringing. Well, that's the noise exposure that you get. And after the concert, in a few hours, it usually goes away. But the more you're exposed to loud sounds, loud noises, the tinnitus can stay. And if you do have a hearing loss, you're more susceptible to having tinnitus. And yes, there is therapy that's available, but in order to prescribe the right therapy, we need to get the diagnosis and do the right evaluation.
All of that makes perfect sense. So I hope that everyone listening out there will take this to heart and have their hearing checked.
And
Definitely, right?
yeah,
These,
absolutely. One thing to mention is that because we are a clinic, we take pretty much all insurances. I know that cost is a big factor, and people say, well, the hearing aids cost a lot. I'm just going to wait. Well, you don't have to wait because some insurances do cover hearing aids. There are unions that cover hearing aids, and we take care of it for you. So when you come in, and you give us your insurance information, we will do all the legwork for you. We will find out if there is a benefit and how much they offer for hearing aids. And you'd be surprised how many people come in and they're not aware that, yes, there is a benefit and they waited for so many years and they could have had hearing aids for quite some time.
yeah. Well, Dr. Fulman, I'm so grateful that you were with me this morning. I appreciate all this good stuff that you've shared with everyone. I think it's so important to protect your hearing. I think it's one of the most important senses that we have. And without it, the world would be very different, right? Very different.
Absolutely, absolutely. And I just wanted to mention that if you're wearing hearing aids and are not sure if they're working properly or not, we are offering free cleanings and checkups of hearing aids to all SCAN members.
Oh,
So
fantastic.
if you call us, uh, please come in. We'll show you our clinic and we'll do a complimentary cleaning and a checkup of hearing aids.
Oh, that's wonderful. Thank you. Thank you so much. We will put that out to our members to let them know. I appreciate that, Dr. Fulman. All right. Thank you
Absolutely.
so much for being with me today. I really, it was excellent to have this conversation and it was needed as well.
Thank you.
So remember out there, if it's important to you, it's important to us. I'm Andrea Tarr, and we'll see you next time on Scan FYI. Bye, everyone. Bye, Dr.